Good morning, everyone. Welcome to the virtual training on the topic of the upskill biomedical engineer for transformation of healthcare and technology support. Today, may I invite our guest speaker, Dr. Olarik Musigavong, to be the great speakers for our training today. For briefing of Dr. Olarik Musigavong, he is now working at the Department of Health, Ministry of Public Health, and Jas Phra Aphai Phubet Hospital, Prachinburi, Thailand. His education, he graduated a medical degree in Khon Kaen University and diploma of Thai Board of Obstetrics and Gynecology from Khon Kaen University, and he also received the master's degree in biotechnology of human assist reproduction and embryology, University of Valencia, Spain. And for his current work, he is the ex-chair of Complementary and Alternative Medicine Special Interest Group of American Society of Reproductive Medicine, USA. And he also the Committee of Medical Council of Thailand, Committee of Continuing Medical Education, Thailand, and also the Committee of Participatory Health Region Board, National Health Commission Office. Okay, this is a briefly of Dr. Olarik Musigavong. So please welcome our guest speaker today, and all of you enjoy our of his talk today. Please welcome.
You're welcome, sir.
Hello, สวัสดีครับHello สวัสดีทุกท่านครับ Thank you for a very kind introduction and good morning everybody. And I think this is very early in some country. Even in Thailand is 9 a.m. and I know that someone from other countries maybe at 7 or 6 a.m. right?
And some places at 4 a.m. and some places they come from the South Africa, South America. So it's around the world.
Okay, I see. So I think this session is not about the presentation, the lecture, but I would like to conduct this session as a two-way communication. Okay, I share my experience on my country and my review, and you please share your ideas from your country. And I think this session will be very fruitful conversation. So I will share my screen first. Okay, make sure you can see my screen, right?
Yeah, we can see.
Thank you, thank you. So today my topic is about the healthcare system for elder society and communities. And this is my introduction. This is a different type of introduction instead of my background from the education, my experience, my work. But this is my personality type that represent why I review the topic. This kind of the opportunities, this kind of like adventure, this kind like go to the 2050, go to the moon, go to the Neptune, because this is my type. Enneagram, my type is 7. Okay, and MBTI is ESFP, and my strength is about my strength finder is this type, who positivity, communication, includer, and maximizer. So that means if you have some difference, okay, some different, you can share your idea. My hospital com, and this is the picture when I was young. I think 5 or 7 years ago. I invent the bed that can help the mother easy for the vaginal delivery. At that time, someone called me I'm a inventor or innovator. And please feel free to contact me. Okay, this is my email. This is my WhatsApp. So if we have the opportunity.
Excuse me.
Yes.
I think you did not show the screen anymore. Sorry.
Okay, I will share my screen again. Can you see my screen now? Okay.
Yes.
Okay, and this is my email and this is my WhatsApp. I hope the Rangsit University will do the WhatsApp group that we can communicate each other easier. And if you come to Thailand, please let me know. I will show you what is Thailand, why Thailand is very good place for the retirement, and why we have very good system for elderly. So this is not do by myself, but this is do it from the organization. It's not only local Thai organization, but from the international organization. They think that Thailand is very good place for the retirement. That's why I think this is a good experience from us to share how to create a good system. Yes, can you hear me?
Yes.
Okay. Okay, so that's why I would like to say that we have some good experience to share to you that how to create a community for the elderly people or retirement people. And this is my hospital. My hospital is a 500 hospital, 500 bed hospital. It's about 110 years already. This is the old palace, and now it's already the museum. The hospital building is in another side. So if you come to Thailand, please let me know. I will show you my hospital. Okay, and by the way, even I work for the public hospital. I'm the advisor for the some real estate company that they do the how to say elderly care for the aging population. For this project is allow you to stay if you are 55-year old until you die. You can see this is a lifetime home. Okay, it is the investment. It is about 10,000 million baht. 10,000 million baht. So it's a big project. Okay, now let's back to the introduction. Why the aging society is very, very important. This is a total fertility rate in Thailand. So you can see since maybe 30 years ago, the total fertility rate is about 6.2, but now it's declines very fast. For the recent year, is about 1.08. 1.08. That means for the couples, there's only 1 and 0.8 children. It's not enough. So this is the pyramid of the demographic of the Thai people. In the 1970s, you can see we have a lot of the children and the teenager. And in the future, in the 2030, the pyramid is changed. You can see we have very few babies, but we have a lot of elderly people. I think same as for the other country, the demography is changed. So why it's very important? You can see by the 2050, the number of the people double. Okay, for the older than 65 years old, from 10 to 20%. Why is very important? Because 80% the world elderly, they live in the low income country. In Thailand, we are the low middle income country. And we know that this is very vulnerable people, fragile people. They don't have the money. They can't help themselves. They are dependent people. They depend on their children. They depend on the government. So this is why it's very, very important. The government have to take care of them. That's why it's very, very important. and 70% of the population expect they locate in the urban area. That means they stay in the very, very small place. You can see the video in the YouTube. In Hong Kong, the place, the room, the total area of the room is about 3 or 4 square meters. It's very, very small because the land is very expensive. Same in Thailand, in Bangkok, the area is very expensive. The house is very expensive. So that means the quality of life of the elderly people is very poor. So that's why we have concern. And on the right side, you can see this is the world map. The color red is about more than 30% and over of the elderly people. In the 2015, you can see the Canada is already red, China is red, and you can see this is Thailand. I'm not sure you can see my arrow. This is Thailand. Okay, our country is like an X. And you can see in Europe, it's all red. In the Scandinavia, it's all red. So we have to concern about these problems. Even from the South America, some countries is already red. I think this is a chili, right? The red color. Okay, this is another picture about the dependency ratio of the elderly people. You can see the South Korea, Singapore, Spain. There's a lot of the number of the dependent elderly people. The size of the circle is a number of the people. So, and by the way, today it is about how to create the smart questions, because we know that if we have the good questions, we will have the good solution. Okay, before go to about the social system, are there any comment, any questions or any idea? So please feel free, open your video and let's talk. So I'm not sure about your countries. Please share. อาจารย์ครับอาจารย์ do you have any idea about the aging society now? If there's no any comment, I will go on.
Hello.
Yes, please, Ibrahim.
Yes, my name is Ibrahim Awal from Ghana,
Okay, how
West
about
Africa.
the situation in Ghana, Ibrahim?
The situation in Ghana is terrible because we don't have any plan for the elderly. So if they are not rich people, they find healthcare access not very accessible. So living is difficult, as he said. We have lands, we have a lot of things to do. But the problem is the average Ghanaian is poor. So accessing healthcare is also difficult, or accessing quality healthcare. An average person working cannot access quality healthcare. If you want quality healthcare, then it means you have to get that from a private institution, which is more expensive. So the elderly people do not have access to that at all. So that is the situation in Ghana.
I see. Totally agree. Same as in Thailand too. So are there any comment from other countries? Before that, I will change my ratio of my screen first because someone said my presentation is too small. Okay. Display. Yes,
Good morning.
Emia, please.
Yes, Amia, I'm from Namibia.
Namibia.
Yes, I'm actually stunned by your presentation to hear that really we have plans for elderly people. In Namibia, it's not the case. In fact, I didn't even know that you can have a plan for elderly people, like to I didn't know that there's a plan actually to help them to assess good quality healthcare or even to take good care of them. From what I know is the elderly people are either taken care by their families, and most of the times they are at home. We have elderly home, is it home age? What is it? Home age, old age homes, sorry. But then those are accessible to those that can afford it.
Mm.
As for healthcare accessibilities, we have hospitals all over the country, and wherever they can access the hospital wherever at their proximity, so they can go to the nearest clinic or health center or any tertiary hospital. But plan for specifically or dedicated for elderly people, we don't have a system like that in place. Yes, thank you.
Thank you, Emia, for your comment. So, okay, it's a very good conversation because now I will talk about the social system that how we can prepare, okay, for the elderly people. Okay.
Hello.
Yes, please. Yes, please.
Hello. I am from Sri Lanka.
Amel, Amal from Sri Lanka.
Yes,
Please.
yes, sir. In our country,
Please turn on your microphone, Amal. Amal, please unmute your microphone. Okay, I think now I can hear you.
hello. Okay. It's around
Now I cannot hear you again. How about other people? Can you hear Amal?
No, it's not audible. I think there is some internet issue.
Okay, Amal, I will back to you, okay, after this. Okay. So now I think you can see my slide better. Okay. So I will talk about the political and social system. You can see for the whole system, the political is very, very important and social system is very important. The health system is another part, just only one part of the political and social system. For this model, the component of the health system, there is healthcare system, public health system, and individual factor. But you can see about the intersection. Something is different, something is there is some link. For example, the healthcare system and public health system, you can see is the same component, but it is a deliver or is prepared from the different provider, the function, the system arrangement, the policy. And you can see for the individual factor is also very, very important. As the comment from the Namibia or Ghana, you can see the individual factor is very, very important about the income, about the culture, about the education. It's very important. That can drive the health, the personal health and healthcare system. And for the big picture, you can see the political and social system is very important, because if the government, they have the good system. For example, in Thailand, we have the universal coverage system. The people can go to the hospital without any payment. I mean, for the some disease, okay, there's a co-payment for some disease, but most of the important disease or basic illness, they don't need to pay the money. Even one US dollar, don't need to pay for it. This is I think this is a gift from the government. Okay, for now, if we don't talk about the sustainability, we are very outdated. So this is another framework that talk about sustainable healthcare system. Is there is a quality, there is institution of the environmental and concern. It is in institution accountability and individual responsibility and long-term strategy to think about the long-term outcome and long-term effect. This is the word of the sustainability. So this is very new in Thailand too. We just talk about the ESG in the, I think it's not over than 5 years, but the hospital or the company in the stock market, they have the KPI or index that they have to do some sustainability project in the company. If they have this kind of the project, there's the better index than other company don't have this project. And this is another framework, but I think it's not different from other framework. It's a patient-centric and bigger view is about for the healthcare provider, for the organization, and for the environment. And you can see this is the scenario of the patient who has the disease. And what is the patient factor, the healthcare provider factor, organization factor, and environment factor. Okay. And this is a new concept about the system thinking. The patient, the family, and community, they have the component of the leadership, the team, the change agency, and we have to think about the ethic and legal. And in the detail, it is about the health system improvement, value in healthcare, the population and public determinant of health, the idea of the big data, the clinical informatics, the health technology. And I think one of very important is about healthcare policy and economic. The money is very, very important, as you know. Okay. And I want to ask you, in your opinion, which one is the best? A, equality, B, equity, C, inclusion, and D, the belonging. So please type in the chat box. I'm waiting for your answer. In your opinion, which one is the correct? Thank you, Amian. D.
I think B.
B, right? Deepika, belonging. Waiting for the more answer. B. There's no right or wrong. It's about your opinion. Because I think for the different context, it's a different answer. For example, for the some area of Thailand, we know the best thing is the belonging. The people in that community should have some link with the project, but we know that they are very poor, they have a low education. Sometimes the government have to prepare everything for them. But that I told you, that I said that is depend on the context. Okay, by the way, mostly it's about B and D. Okay. Dr. Thitiphorn said B is ideal. B is achievable. Totally agree, because we are staying in Thailand, in the same country. We know what is our country context. So let's move. So this is a very old video. Okay, I will show you. It's very short video, but it's very impact in the past until now.
กินเหล้ากินเหล้ากินเหล้าตอนเครียดกินเหล้าเครียดกินเหล้าก็เลยยิ่งก็เลิกสิเหล้าเลิกเหล้าเลิกจนเริ่มต้นเข้าพรรษานี้เหล้าเลิกจนเริ่มต้นเข้าพรรษานี้
I can move to next slide. Now can you see my screen now?
Yes.
Okay. So this is the kind of the vicious cycle. Okay. In the video, it's about the poor, it's about the depressed, and then the action is about the drink, the alcohol. So this is the kind of the vicious cycle. I think same as other many countries. Okay, low education, poverty, and illness. And then illness, low education, poor. Okay, but the question is how we can break this vicious cycle. And we know that it's not easy, but I think we have some solution that can help, that can solve this problem. Okay, let's move to the how can we categorize the system. And this is my personal idea, my personal experience. The first one is about the local-based approach. Okay, we know that when we see the patient, I'm the doctor. Most of my workplace is in the hospital. But actually for the patient, there is other base. There is a community base, there is a home base. This is the first approach. And I think this is the easiest approach in my idea. If we can categorize the how to say approach, we can plan the solution, we can plan the staff, we can plan the budget easier. I can show you. Okay, when we know the local bed approach, and then we let's move to the patient journey. The 5 steps of the patient journey start with there's awareness, recognition, and then go to the hospital to the diagnosis and treatment. And then the patient will select which hospital they will go to the treatment and stay there and follow up. But if they decide not continue the treatment in that hospital, then switch to other hospital. This is the simple, the basic patient journey. Okay, Let's see. I can show you this is the patient journey of the oncology patient. Okay, go to the hospital, do the diagnosis. But you can see this is categorized in the office, I mean the hospital, and at home. And you can see there is a different healthcare provider get involved in their journey. In the office, I mean in the hospital, mostly it's a doctor, the patient, the nurse, and the caregiver. If they're back to their home or their community, maybe the doctor don't have the role in that area. Okay, this is for the diagnosis. And for the treatment decision, you can see there's a lot of that. The social circle impact their design and impact their treatment. So back to your context, for the elderly people in your countries, in your city, who will get involved in the patient journey of elderly people. There is another example of the patient journey, but this is more complex. You can see for the onco patient journey, it's like the stress, but sometimes for the very difficult disease, just go to see the doctor. You cannot get the diagnosis and the good treatment. It's like a mess. The patient has to go to one hospital, go to the second hospital, go to the third hospital. Maybe sometimes they have to go to the temple in Thailand because the doctor cannot solve their problems. They have to find something very spiritual to get the answer. Okay, this is very, very complex patient journey. Okay, and let's move that. I'm very totally agree about most of the treatment now move to the home base, not only in the hospital base. This is the model in home care. You can categorize the patient to the healthy, chronic, failed, and advanced illness. The different state of the disease is a different intervention. For the healthy people, maybe you don't need any intervention at home. Just go to the hospital to check up. Are there any disease? Are there any risk for the progression of the disease in the future? I think this model is from the USA. Okay, but by the way, this is about prevention care and health maintenance. For the acute care, okay, some diseases already can do the in-home care. In the US, if the patient go to the ER with the acute condition, some disease can decide to treat at home. It's cheaper in the hospital than in the hospital, but it depends on the status of the patient. And post-acute, most of the hospital, even in Thailand, they discharge the patient back to their home and send the healthcare provider to take care at home and use some technology, for example, the telemedicine, to take care of them. And you can see the last one, end of life care. We know that maybe 80 or 90% of the cost of the treatment is in end of life care. So now we move from the hospital to the home. Okay, for the healthcare system, it's cheaper. And for the patient or the family perspective, it's better to stay at home for the end of life care. And for the technology, now we talk about the smart system, right? This is some kind of the innovation we can use for the elderly people. This wearable device can get the signal, for the physical, for example, the EKG, the respiratory rate, the temperature, the tremor, the gait, the sleep, and some device can check the chemical, blood sugar, the electrolyte, the pH, the oxygen sat, and we can use this data to diagnosis or some disease, for example, the dementia, the Parkinson disease, Alzheimer disease, cardiovascular disease, or hypertension. This is another approach. This is we call the lifestyle approach. We can divide the patient on their age. I will pass this slide because today we'll talk about the elderly people. Okay, and this is about the status based healthy people at least or already have the disease. This is another kind of the approach that Thailand use because we have the different organization to take care of the type of the people. Mostly in the hospital, in the tertiary care, we focus on the illness. But for the community hospital, the small hospital, mostly we focus on the healthy people and patient at least because it's easier for the treatment. And for the advanced technology, we will put everything in the tertiary care hospital. Okay, this is another kind of the approach we call the action-based approach: promotion, the prevention, the treatment, the rehab, and consumer protection. And how about your opinion? What is the healthy aging in your opinion? So please type in the chat box. The question is too easy, right? Totally agree. Totally agree. So this framework I read it from the McKinsey, the Health Institute. I think this is very easy to understand framework. The McKinsey said there is 4 factors. If you want to have the good health, it's about the physical, social, spiritual, and mental. And this is the factor, personal factor, and social factor. The problem is we know this is the factor, but how we can help the elderly people to have good factors. This is another concept of we call the lifestyle medicine. There is a 6 pillar. Okay, there is a nutrition, exercise, tobacco and alcohol, stress management, sleep, and healthy relationship. If the people have good 6 pillar, we will have the good health. And Dr. Titiporn, she is one of the experts on this field. Maybe she can share in the Q&A session. Okay, and this is a 6 shift of the healthcare aging. This is from the McKinsey too. We have to invest the promotion of the healthy aging, improve the measurable, have the good KPI.
Hello.
Yes, Ibrahim.
Please, the previous slide. I don't understand. Yes, this one. I don't understand the tobacco and the alcohol part.
Okay, so if we want to have the good health, we have to decrease tobacco and alcohol and any substance use. For the nutrition, for the exercise, for the stress management, we have to increase the quality. But for the tobacco and alcohol, we have to decrease or diminish this one.
Okay.
Because in some countries, they use a lot of alcohol and tobacco. Thank you, Ibrahim.
Thank you.
Okay, for the first step is accelerate the innovation. The fifth step is about unleash the potential of the industry, because we know that it's not only from the government side that can help the people, but the private sector or the company, there's the role to increase the health system too. And the last one is empower and motivate the older adults to live to their own potential. Okay, what is the smart system? Now it's already 45 minutes past, but I just talk about the smart system. So you can search on the Google about the hype cycle of the top 50 emerging digital health trends. You can see the longevity research, rising of the expectation, but much forget not expected. You can see this is a red color. Everybody need a good healthcare, need to stay longer, but we know that we don't have the fully solution yet. We have to wait for the new innovation, and we know it's not easy. Everybody search for the immortal, I mean, life longer, since Egyptian, from the Chinese, any country, any people, they want to live longer, but we don't have the solution yet. But in the future, who knows? Okay, this is the market map of the age tech. We call the age tech. If you want to live longer or better healthcare when you are older, we use the search term age tech. Okay, you can subscribe from the gerontechnology.com. They categorize in health, in the wellness, senior living, blah, 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 for caregiver, for cognitive care. For the companionship, home care is depend on the how you categorize. But who will use the digital health? 4P. The patient, they use by themselves, the healthcare provider, the public, and the policy maker. Okay, this is another type of the categorization. Okay, this is a 6 functional capability for which technology can help the positive impact. When you get older, there's the problem about the cognition, about the community, about the transportation, personal mobility, and access to healthcare, as the Ibrahim said. We have some technology to solve the problems. And we know that we have a lot of the technology, but what is never changed? Everybody want the cheaper, better, faster. And in the Buddhist, we have the concept of, this is 4 concepts: birth, there's illness or the injury, get old, and death. This is never changed. We want to stop this process. We want to have the better birth, slower, get older, less illness, less injury, and good death. This is never changed for more than 3,000 years. But nowadays we have some technology can help us. So I think I have 10 minutes left. So I will go to this very fast to a Q&A session. We know that this is never change. Okay, everybody wants cheaper, faster, better. And what is increasing? It is about expectation from the people, because we have the social media. We know that other people have the good life, other people have the good treatment. So the expectation of the patient, even for the healthcare provider, is increasing. So this is our role to how to take care the patient or the people from that expectation. So this is my last slide. So the best way to predict of the future, the future, there's a lot of the problem about elderly people. So how we can prevent or invent the solution for them. Thank you. So let's move to a Q&A session. So are there any comment about the technology or the healthcare system?
Thank you very much for your presentation. So the next session is just like Q&A. If anyone have some questions, so you can directly ask to Dr. Olarik. Please feel free. Or you can share your background and you can share the problems or your idea of the solution in your home country.
Actually, I do have some example or the case study in Thailand. Okay, for example, in the elderly care, okay, is depend on you call it the nursing home or the silver age apartment. So they focus on the patient journey and patient need. We call the people centric. Because of the different age, different state of life, they have the different need. We can categorize the patient, the people, to the three colors. Okay, green, yellow, and red. For the green is independent. They are 60 years old, but very strong. They go to golf, they go to work. But for the people is dependent, is already red color. They have stay on the bed. They cannot walk by themselves. So different state of life. So different need. But you have to think about who will take care them, who will pay for them. I think same of is the same thing that we have to have someone to pay for it. Sometimes the government cannot pay for it and the patient cannot pay for it. Who is the payer? In Thailand, there's some solution from the insurance company. Okay, the insurance company, if the patient they pay for the insurance, maybe in the future when they are already retired, they can get the insurance from the insurance company.
I have one question about the elder society with the technology. So I experienced myself because I live together with my old mother. So when we talk about the elder people, sometimes we want to do the technology integrated with their life, living life. Of course, that I prefer that she gonna wear some of the smartwatch or doing something at house installation. However, the old people, normally, they're not familiar with the technology. So what do you think in that case? Because, it's just like in the opposite side, the technology is increasing, but the elder people, they are just like away from the technology.
So this is the, how to say, the question or the how can I ask? This is the role of the company, the technology company, to create the technology easy to use from the elderly people. For example, for the smartwatch, we know that they can detect the falling, right? But we know that for the elderly people, they don't want to wear the watch. And when they go to the shower, they take it off.
Yeah.
So the solution should be like they have the wearing as the necklace, because we know Thai people we wear the necklace
Mhm,
with a small like jewel or something like that.
mhm,
So some startup company they create this type of the technology, not smartwatch, but this is a necklace, or even there's a smart camera. They can detect the falling in-house without the picture.
mhm,
They use other signal, because if we take the picture for the whole time, the patient they will lose their privacy,
mhm,
especially in the toilet or in the bathroom. That is the place there's a falling
mhm,
incident.
mhm.
So we use like they use like an infrared camera to detect the falling, and then there is automatic alarm signal to the hospital or even to uh, the the phone of their children.
Mhm. Okay,ค่ะ. Because of I facing with the problems with my old people in my family, so that's why I pop up in this question. So anyone want to share, or anyone want to ask the question and just like sharing your idea? Because I think that Dr. Olarik will stay with us for more 5 minutes, because we are so sorry that he is on the duty of the OPD today. So this is very very grateful that he share his available time to our presentation today. So just feel free to ask.
Can I come in? Prof, I actually agree with you on the wearable devices for the elderly people. In my country, it's the same. But for me, I was going to be more interested if you can expand more on the use of those wearable devices, because some of them are like new to me. I didn't even know, because I saw socks. I don't know what they can be used for. I was really going to appreciate if you can expand more, or maybe just give us the use on how it can be used. Thank you.
Okay. Yes, for most of our participants are biomedical engineers, and they work sometimes in the hospital and some of the healthcare sectors in different countries. So the role of the BME or biomedical engineer in the elder society, what do you think that what they can do in case if they work in the hospital?
So I think for the different, how to say, there's you have to seek for the pain point of the patient, okay, and you can use your knowledge to create the innovation to solve that problems. Actually, I have another word. I'm not sure I do have a time. I'm very like this idea. We call the how to say. Let me check. Jugaad. I'm not sure. Do you know the Jugaad? Is an Indian word. They can solve the problem with the idea without the high technology. I can show you some video. So you can use your knowledge, okay, to solve the problem, but you have to see the problem. I'm not sure. Can you see my screen now? Yes, can you see my screen?
Yes, yes, we can see.
This is the idea of the Jugaad. You can see this guy is he's an Indian guy, and he invent the solution for the disability people. It's very cheap, but you have to have the idea. You can see he bring the new shoe. Just only the shoe. The shoe is already sell in the market, but he apply.
Mhm.
The problem is how you have this idea. You have to empathize. You have to notice. You have to have the good community
Mhm.
to ask. But have to do as the patient centric, and then discuss and to empathize and find a solution for them. So back to your knowledge. If you are the biomedical, you already have the knowledge, but you have to apply it with the team and empathize the patient or the people.
Mhm. So it means that sometimes the solution shouldn't be the very high technology, but sometimes it's very simple, but just hit the pain point to solve the problem, to make the patient's life getting more easy, or just make they have the good life. That's
As
the
you
reason.
can see here, create a hand for him.
Mhm.
Not very high technology, but it can solve the problems.
Mhm. Mhm.
Okay, this is my answer.
Thank you very much. Okay. So anyone have more question? Okay, due to the limited of the time, because Dr. Olarik need to run back to his duty on the OPD. Okay, in the case if you still have the question, but you don't have the time to ask right now, so you can always type on the chat box or our WhatsApp, and then we can ask Dr. Olarik for sharing the idea. And okay, Dr. Olarik already kindly typed his email in the chat box. So in the case if you want to discuss with him directly, so please feel free to contact him. So thank you very much for all of the participants, and thank you very much for your fruitful sharing experience for today, and for your valuable time that, okay, I heard that you need to swap your OPD schedule to our talking today. Thank you very much for joining us, and thank you again. Thank you ค่ะ ขอบพระคุณค่ะ
สวัสดีครับ
สวัสดีค่ะ
สวัสดีทุกท่านครับ สวัสดีครับ